Hello, everyone, and welcome to the show. Today, I am honored to have a very special doctor, Dr. Serge Mattar from the Orchid Fertility Clinic. He is the consultant reproductive medicine and infertility specialist. He has over a decade of experience in leading fertility centers across Canada, Qatar, Oman, Lebanon, and the UAE. He's also fellow of the Royal College of Physicians and Surgeons of Canada in Gynecologic, Reproductive, Endocrinology, and Infertility Center. So I'm very honored to have Dr. with us. So the Orchid Fertility Center and Clinic is very special, and you are a very important part of it. Please tell us about, your specialization.
So basically, as the name suggests, it's a fertility clinic. So we handle all cases of fertility. And when I say all cases, we mean female fertility issues, male fertility issues, compound couple factors, and even nowadays, fertility preservation options.
I think this open, complete, holistic overview is very valuable insight for the audience. Doctor, what are the aspects that can also influence a healthy fertility chance? Does age, and also for the man and the woman, the diet, the environment? Are these factors trivial?
All of the above.
Hmm.
But no doubt that age is the main key factor in determining the fertility potential. So if we want to put this into perspective, the moment a woman is born, the moment she's out of the uterus of her mom, she has in her ovaries, on average, 1 to 2 million eggs. She starts losing these eggs even before she reaches puberty, even before she starts menstruating. By the time she's at puberty, like let's say 11, 12 years old, this number that we started from, which is 1 to 2 million,
Mhm.
is already halved. So around puberty, a woman has in her ovaries around 300,000 to 500,000 remaining eggs. And this loss continues gradual over the years, but becomes more intense. Their loss becomes sharper after the age of 35.
This is news because people did not know this important aspect about, and age does matter. How about nutrition? And how about, do you also recommend your client a certain, lifestyle to endure while they're in the
So
care?
this answer is really case by case. We take pride by providing a personalized approach.
Mhm.
So, obviously, when we do our initial assessment, we don't only look at the reproductive history or the gynecologic history. We look at literally everything. Honestly, the first question I ask my patient is, what do you do? What do you work?
Yes.
I'm not curious to know what do they do for a living. I just want to assess their exposure.
Mm.
For example, people working with lots of chemicals, like in agriculture, exposed to pesticides, insecticides, people working in oil and gas industry, they are exposed to all these chemicals that could eventually affect the quality and
Absolutely.
the number of their eggs. I ask about their diet.
Mm.
I check their body composition, their percentage of fat, their percentage of muscle, and we try to ameliorate that before embarking on any fertility journey. I check their social habits, their smoking history, their alcohol intake history, because both smoking and alcohol could significantly affect the number and the quality of eggs.
And doctor, what is the perfect age? I mean, what is the desired age would you recommend? I know this is why we are coming to the orchid fertility, but how would you advise to seek?
Honestly,
Mm.
the earlier the better, but it's not always applicable from a personal or social perspective. Like, no doubt that the chance of conception for a 22 years old woman is significantly higher than the chance of conception for a 39 years old woman. But not every 22-year-old woman is ready to have a child. That's why here comes the importance of fertility preservation options. And when we talk about fertility preservation, we have to understand the different indications for fertility preservation. It can be simply, as I just mentioned, for age related fertility loss. You are at a certain stage of your life where you're not ready to have a child because you're giving priority to your career or
Yes.
to your education, or simply because you did not find the right partner yet. So you have to consider freezing your eggs to be able to use them at a later stage. But not all fertility preservation are simply for age related fertility loss. They could have some real medical indications.
Yes.
Like some women are at risk of what we call POI, which is primary ovarian insufficiency. The lay term for that, which I hate, is premature menopause.
Hmm.
So some women have a family history of early menopause, like her mom, her aunts, her sisters.
Yes.
We should screen her genetics to make sure that herself she's not also at such a risk, because if she is, also she has to consider freezing her eggs before reaching that stage. Fertility preservation also could be considered for women considering some form of ovarian surgery, like she might have a cyst on the ovary.
Yes.
Prior to resecting this cyst, because once you resect the cyst, no matter how good of a surgeon you are, indirectly you will remove some healthy ovarian tissue surrounding it. And this healthy ovarian tissue contains 100,000 of eggs. So we should also consider freezing the eggs to preserve the fertility before going into such ovarian surgery. Or other women might have what we call endometriosis, which is a condition in the pelvis where blood distributed across the pelvis could create a form of inflammation. And this inflammation will kill the eggs at a rapid rate. Also, they are candidates for fertility preservation. And we should not forget women with a cancer diagnosis before going into their chemotherapy or radiotherapy, because these treatments will kill the eggs. So we should consider freezing their eggs before going into the cancer treatment journey. So there are multiple indications for fertility preservation that a woman should think of in order to preserve her
Yes.
fertility and to keep all her options open for the future.
I think this is such valuable information, doctor. There is one more, like, which is a misconception. It can also be an issue with the male, right? Because usually it's, I think maybe it's more um, understood that it would be from the woman's side, but this issue can also come from the male side.
Absolutely. Fertility is a joint project.
Yes.
It's 40% female, 40% male, and we do have 20% combined factors.
Mm-hmm.
So sometimes, and this combined factor is very interesting because you might have a couple
Mm-hmm.
together trying to get pregnant for the past 5 years and never succeeded. But if the woman tries with a different partner, she immediately gets pregnant, and vice versa. So there are many theories behind these combined factors. Is it an immunologic factor? Is it her immune system reacting to the sperm of this particular man? Is it some genetic factors because they carry some genetic incompatibility? There are so many explanations, and that's why fertility field is very interesting, because
Yes.
we have lots to think about.
Amazing. So I want to know about the IVF. Um, can you tell us, for a common person to understand it better, and its entire holistic idea of what is it all about?
So as you can imagine it, unfortunately, in IVF, most of the work is done on the women. The woman will be taking daily hormone injections for a period, on average, between 10 to 12 days. Some
Right.
women might finish earlier, others might take a bit longer, like 2 weeks, 20 days, but the average is around 12 days. During these 12 days, we need to see the woman at the clinic around 2 to 3 times maximum, very quick visits. We do ultrasounds. Sometimes we also do blood tests to monitor the growth of the eggs. Once the eggs are ready, we put the woman under a very mild anesthesia. It's not like general anesthesia. There is no intubation involved. It's just like a deep sedation. So she sleeps, she feels literally nothing. Using a very thin needle, we go and we aspirate the eggs. The same day we aspirate the eggs, we ask the male partner to give us a sperm sample. So now we have eggs from the woman, sperm from the man. Once combined together, they fertilize. The result of this fertilization creates an embryo.
Right.
We keep the embryo in the lab for around 5 days. On day 5, the embryo on average is made from around 300 cells. We take a biopsy, 2 to 3 cells out of these 300 cells, and we run genetic testing on them. Once we determine the genetically normal embryos, we freeze them.
Mm-hmm.
Once frozen, the embryos retain the age of the woman at which they were frozen forever. What does that mean? If a lady is 32 years old and she's doing her IVF cycle, her eggs and eventually her embryos will forever remain 32. So even if she comes back later at the age of 40 or 45
5 years later.
or even more, her chance of pregnancy will be almost equal to any 32-year-old lady. Because
Amazing.
IVF, the aim of IVF is not only to immediately treat and lead to a pregnancy, but also it might be a form of fertility preservation for later. And the trick in IVF that we have to understand that during these steps, we have consecutive losses. We lose at each step. And I think this is very important to clarify. And this is what most patients fail to understand on the first visit, because I don't want anyone to have unrealistic expectations. Let me give a more concrete example. Let's say we do the initial ultrasound, we do what we call an antral follicular count. We count the follicles, which kind of reflect the number of eggs that she can produce each month. Let's say we tell her she has 15 eggs, for example. When we give the hormones, not all of these 15 eggs will grow. Some will not respond. Maybe 13 will respond. These 13, we might not be able to retrieve or aspirate all of them. Some might be simply empty follicles, like a bag of fluid with no egg inside. We might get 11. These 11, not all might be mature. Maybe 9 are mature. These 9 that are mature, not all will fertilize with the sperm of the male partner. Maybe 7 will fertilize. These 7, not all will survive in the lab till day 5. Some will die day 1, day 2, day 3, day 4, day 5. That's totally normal. This is natural selection, like nature eliminating the unqualified ones. I might reach day 5, maybe I have 5 embryos. 5 embryos, when I genetically test them, not all might turn to be genetically normal. Maybe 3 are genetically normal. 3 genetically normal embryos do not equal 3 children guaranteed, because the chance of pregnancy with each genetically normal embryo transferred back inside the uterus is around 60-70% in the best case scenario. I personally always like to assume the worst scenario, not to have negative surprises later on. So let's say I transfer the first one and there's no pregnancy. Fine, I told you it's never 100%. The good thing, you still have 2 remaining frozen ones.
Yes.
All what you have to do, remove the second from the freezer, thaw it, and transfer it. Again, we have 60-70% chance of pregnancy. Let's say this time she gets pregnant. She goes, gets pregnant, delivers, live with the baby 2, 3, 4, 5 years, as much as you like. Come back after 4 years. You want a little brother or sister. You still have a third embryo.
Amazing.
Again, thaw it, transfer it, 60-70% chance of pregnancy. So applying the 70% rule to the hypothetical 3 embryos that we have, you might be able to get 2 babies from 1 IVF cycle. And this is the important point about the losses that I would like to clarify.
Doctor, I wanted to inquire about this very important question that has been asked many times. What is the difference between freezing an egg and freezing an embryo? And the genetics, how important does the role play?
Concerning eggs versus embryos, both are technically feasible. Obviously, each has its own advantages and disadvantages. The egg is just one cell. However, the embryo on day 5 is made from around 300 cells. So technically, it's more resistant to the lab environment. So if anything goes wrong during the process of freezing or thawing, if few cells are affected, the embryo can divide in milliseconds and make up for them. But for an egg, which is just one cell,
Right.
if anything goes wrong, we just lose the eggs. So from a technical perspective, the embryo is more resistant to the lab factors and lab environment. That's point number 1. Point number 2, the fact that the embryo is made from many cells, we can always take few and genetically test them.
Okay.
So we can know which embryo is genetically normal, which embryo is not. However, an egg, we cannot genetically test it because it is made only from one cell. Point number 3, the egg belongs exclusively to the woman. So she can use it later with whoever partner she chooses. But the embryo belongs to the couple. So if any form of separation happens, God forbid death or separation or divorce, she cannot use it separately. Hence, it's important to weigh the pros and cons of each one to make an informed decision which one works better for you. Also,
Amazing.
there is a point number 4, which is the prognostic evaluation. As I just said, once you have an embryo, you kind of have an idea what is the chance that this embryo will give me a live birth. But once you have an egg, it's difficult to predict if it's going to fertilize and if it will develop into an embryo and if this embryo will implant. As I said, we do have some calculators to give some projections, but these are just calculations.
We're happy to be in this time because of the research. And also, I would like to know about the specific, holistic advantages of Orchid Fertility Clinic. How do you want to share? How is it providing a high researched back practitioners and facilities?
The good thing about Orchid is, as you correctly mentioned, we do have a holistic approach and everything is in one place. So we have our clinics, we have our surgical rooms where we perform our egg retrieval and embryo transfer, we have a state of the art embryology lab, and we have our storage unit where we freeze the eggs and the embryos. And not only we have reproductive medicine doctors, we also have andrologists, which mainly take part of the male issues. We have a dietitian, we have a psychologist to support the couple in this journey. So really we have a holistic team all in one place. And this is the advantage of Orchid, that the patient does not have to worry where the surgery is being performed. We're not taking her to a different center. She does not have to worry where the eggs or embryos are going to be frozen. She does not have to go see dietitian elsewhere. Everything in one place, A to Z, to really ensure the smoothest path possible.
Yes, and it's been over a decade of its, legacy here, and with having amazing practitioners, and also about the egg freezing. I would like you to shed some light on this aspect.
Absolutely. So the best way to think about egg freezing is to rewind a bit and think about the full IVF process. In IVF, I explained you take the hormones, you follow the growth of the eggs, you aspirate the eggs, and you fertilize these eggs with the sperm. Egg freezing is simply you stop, one step before. So you don't fertilize the eggs. Whatever eggs you get, you freeze them. So they can be frozen for an indefinite number of time or years, and at a later stage, thawed, removed from the freezer, and fertilized. Here comes the challenge, because as I just described in IVF, that we do have losses. So I just told you, if I get 9 eggs, not all of these 9 will translate into babies.
Yes.
Which makes it a bit challenging for women opting for egg freezing. Because the first question they ask me, doctor, you just told me I will lose from these eggs. Not all will fertilize. Not all embryos will be genetically normal. So how do I feel about this? Is it enough reassurance for me that these eggs will give me something? It's a bit tricky. That's why we created some form of a calculator driven by AI, by artificial intelligence,
Interesting.
where we feed this calculator all the data about women around the world who have went through the process of egg freezing, and we followed them over time to see how many live births resulted from these eggs. So we log, once we finish the process, we log certain criteria, like the number of eggs that we got, the quality of these eggs, and mainly, as I just said, the age of the woman, which again is our major key determining factor. And based on these criteria, the calculator will give us an estimate.
Phenomenal.
Based on these eggs, your chance of having one live birth in the future, if you use them, is around, let's say, 70%. Your chance of having 2 live births is 40%. And honestly, I don't interfere in the woman's decision. I leave the decision to her. Because some women might tell me, fantastic, I'm very happy. Now I'm 0. I changed my 0 into 70%. Thank you so much. I'm so grateful. Or other women might tell me, I don't like this 40% chance of having 2 kids. I want a 90% guarantee of having 5 children. We like big families. In that case, you might need to do the process again to accumulate more eggs in order to increase your chances.
Phenomenal. I think we're blessed to be in UAE with such a high tech research backed Orchid Fertility Clinic. And what is the I want to also, and I know we'll have our other guests speak about this, but you not only provide the the high tech details, but also the emotional side of things, right? So it's like a journey. Uh,
Absolutely.
yes.
And this is the biggest misconception, because many people, when they ask me, what do you do? What do you work? What's your job? I tell them I'm a fertility doctor. I'm an IVF doctor. And their immediate reaction, oh, it's a happy specialty. Not really. Can you imagine calling 50% of your patients with bad news? I just told you the chance of success with each embryo transfer is 60%, probably 70% in the best case. So imagine you have 50% of your patients on daily basis. You're calling them with bad news. Can you imagine the psychological pressure on us as physicians and practitioners and on the patient? And here comes the importance of really understanding the psychology of the patient, how to hold their hand during this journey, really, in order to reach the ultimate target together, because the path is not always easy.
Yes. What is the advice as we end that you would like to give to the patients who are mentally preparing themselves towards embarking on this journey, and how is it and how can they get in touch? We will have all of the details in the captions.
Honestly, the best advice is take the first step and inquire.
Hmm.
Go ask a professional, book a consultation, and come see a real fertility doctor, a real professional.
Yes.
Many women are delaying this step either from fear or simply because they think that now they can get the answers through ChatGPT, or because they had a neighbor who went through a certain experience. Never let this prevent you from taking the first step and go inquire. Just ask your questions. At least you will know your options. At least you will be able to go through an informed decision.
Yes. And it's unique for every individual and couple.
Absolutely. Absolutely. If your neighbor had a bad experience, it does not mean that you will have a bad experience.
Exactly.
If your neighbor got pregnant on the first trial, it does not mean you will get pregnant on the first trial. If your neighbor required IVF, it does not mean that you will require IVF. Your issue might be as simple as probably losing some weight. So take the first step, go seek a professional opinion.
You know, I am so grateful the service that you are doing, because I know you are going to a lot of speaking events and conferences, and there's a lot of education that needs to be, transferred.
Absolutely. And I believe the new model for clinician is different than the old days. In the old days, a clinician used to sit in their clinic and just provide medical services. I highly believe that now, these days, our duty is not only to provide medical services, we have to provide awareness.
Yes.
It's part of our duty. We're obliged to provide awareness, because by spreading awareness, by spreading knowledge, you empower patients to take this first step that I just mentioned.
Dr. Serge, I am so grateful for this opportunity where you can share, and you have shared such valuable information, and you have helped everyone seek. And I have so many inquiries, and I think the best way is to seek consultation from you. And do you have specific days for booking an appointment? It's all through.
It's very easy.
Hmm.
Just reach to Orchid Fertility Clinic. They will give you all the information.
Yes. Thank you so much, Doctor, for this beautiful interview. And we hope to see you again.
Thank you so much for having me. It was a real pleasure.
Thank you. Hello, everyone, and we are here with our special second guest. And today we have Cassie Destino with us. She is an amazing certified fertility doula and the founder for the IVF Support UAE. And she is part of the Orchid Fertility family. And please welcome to the show. How are you today?
I'm very well. Thank you so much.
So tell us about your journey. Tell us about this wonderful side that you also experienced, and then you are part of the Orchid Fertility family.
So I also had IVF. I had to do 3 IVF cycles, including 2 as a very new expat here in the UAE. I had just moved to the UAE and needed to have an IVF, and had to find my own way through finding a clinic, finding a doctor. This was 11 years ago, when it wasn't quite as easy. There weren't as many clinics. There wasn't as much information. I eventually find a doctor, did 2 cycles. And on my second cycle, I was very lucky and I had twins, boy and girl twins,
Wonderful.
who have just turned 10 years old last month. And I found that to be a very difficult and isolating experience, not having a community here, not knowing where to find information. And so I started IVF Support UAE when my twins were about a year old, because I wanted to create the community that I wished I'd had. And over the 9 years that IVF Support UAE has been around, we've grown to about 6,000 members. We work with all of the clinics here in the UAE. And a few years ago, I decided to get trained as a doula. And that means that I help support women through their fertility journey. I have learned about all the reasons why people struggle to get pregnant, whereas before I could tell you about why I struggled, but I didn't really know about other reasons. But now with my training, I'm much more able to provide a really holistic support for women going through fertility. And I have been so lucky to be able to work with Orchid, which has always been a really special clinic to me. I have many friends who have had successful cycles with Orchid, and the opportunity came up to work more directly with them. And I was really, really happy for that.
That sounds so phenomenal, because in the whole journey of your IVF, you built this beautiful community. Just before the interview, you told me about how many women are there in
We've got about 6,000, yeah.
In the UAE.
Mostly, yeah. Or considering coming to the UAE for their treatment.
Yes. And tell me about more of your inclusion in the Orchid Fertility clinic. How is it that, because I feel there's a lot of emotional side of things for the patients, and how is it that you are so pivotal towards carrying them in that journey?
Well, what I'm doing with Orchid, what Orchid was doing before me, is trying to create a space for our patients to feel part of something larger, to have a more holistic support. They have, obviously, it almost goes without saying, they have excellent medical care at Orchid. But what we are doing now is we are extending that to emotional support. We've started hosting regular coffee mornings to give women an opportunity to meet each other on a peer-to-peer level, to have someone to speak to normalize what they're going through. I think for a lot of women going through an infertility journey, especially a protracted one, a longer infertility journey, can feel very, very isolating, because you'll know so many people who didn't have to do that to create their families. And what we want to do is show you, look, this is part of life and it's normal. And you're going to meet a bunch of other women who are going through this too. And it doesn't have to be this isolating, lonely experience. We can connect you to other women like myself who have gone through it. We also have an in-house psychologist who is extraordinary, who our patients have an opportunity to sit down with and get that kind of support. And we just want people to feel that they're being looked after from all sides.
Yes, 100%. I mean, my most important question relating and coming to this is, how does IVF impact relationships?
That's a great question. And there are so many different ways that it can. If you're talking about your primary romantic relationship, it can impact it, because for some women, there is a lot of feeling of guilt and shame around having to go through fertility treatment. There are messages in our culture that tell women that their jobs is to have babies. And when they aren't able to do that naturally on their own, they can feel like they are failing their partner. It's a very difficult and physical situation for a woman to go through that can affect intimacy with their partner. It can affect the way that you might have had some innocence around creating a family, and you'll look differently on parenthood and pregnancy.
Yes.
It can also impact relationships because sometimes one person feels about their infertility journey in a different way than the other one does. And there can be a sort of imbalance of maybe the woman thinking about it all the time and making her choices, and everything she does is about it. And the men don't really understand it as much. It can also affect friendships. If you have a circle of friends where people are having babies and inviting you to baby showers and birthday parties, that can be very, very difficult. And you can find that your world shrinks as you're going through this. You don't want to follow your friend on Instagram because she's posting lots of pictures of her pregnancy, and that's really triggering. Or you don't want to go to, we've just come through the holidays. Maybe you don't feel like going to the parties because there's going to be a bunch of children and babies there, and that's going to be difficult for you. So it can really affect your relationship in many, many ways.
So how does Orchid Fertility support these patients towards, having the most natural and healthier way of going through the IVF process?
Well, what we are trying to do is help women normalize the process. And, for a lot of people, they don't talk about their infertility.
Yes.
Certainly not at a dinner party with your friends.
Pictures,
Yes. So we want to give women an opportunity to put words to their experience with other women who understand, and for them to feel like, look, this isn't ideal, but it's not abnormal. This is a thing that lots of people go through. There wouldn't be so much technology around infertility care if a lot of people didn't experience it. So we're trying to show you, listen, we're here. We're here to support you. You don't have to walk alone through this. I have walked this path. I'm turning around and extending my hand to you and pulling you through the journey to hopefully bring you to my side of the experience where you've created a family that you wanted to. And, Orchid wants to be a part of helping you realize that it's just part of care. And, there's so many parts of care that we offer, from medical to psychological to nutrition and peer-to-peer support.
Wow, I think that is the backbone of the entire journey. And also in the UAE context, do you feel that conversations around fertility and IVF are becoming a little bit more open and receptive?
I'm not sure that it's specific to the UAE, but I do think that more and more people are talking about it. I think as we have younger generations now starting to go through their own fertility journey, they're much more open with talking about it, with making a TikTok account about it. With it doesn't seem to be so stigmatized.
Yes.
When IVF was invented after I was born, so I did not grow up with IVF children, but my children are, and they know that they are IVF children, and a great number of their friends are too. So it's less of a stigma now. The more we have celebrities talking about their fertility journeys, the more normalized it becomes. And I think the UAE is certainly a part of that. We do have lots of young people here. I'm seeing personally more and more people significantly younger than I was when I was going through my fertility journey. And they're just much more open about it.
And I think also the doctors and the practitioners, and it's like at the Orchid Fertility, I felt it through your conversations and with the environment. It's very supportive. It's like it's like you're not feeling out of the circle, and you're feeling very much connected, involved. Like, it's not like a transaction, or it's more of a fulfilled journey. Like the doctor also mentioned in the first part, when it's from start to end. It's like a complete support system.
Yeah, well, that's what we hope to be, certainly.
Yes. So in the end, would you like to share your message, because you're also part of an amazing IVF support group for women? How is it that they can manage this issue more naturally in a stress-free way?
Well, I mean, I'm not going to lie. Going through fertility treatment can be quite stressful. And, I think that Dr. Serge made some good points that a wonderful first start is to really educate yourself, find a doctor that you feel comfortable with, put your faith and your trust in them, and do what they tell you to do.
Number one.
But I also would encourage people to think about that there is a mental load to fertility treatment that I have seen really take people by surprise, and to try to understand that this can be unpredictable and there are ups and downs. People talk about it as feeling like a roller coaster, and to just be aware going through, it's not always a linear start to finish.
Yes, there might be a bumpy road.
There might be a bumpy road, and that's okay. And I had a bumpy road, and I ended up at my destination anyway.
Beautiful.
And you need to just try to ride along on that bumpy road and trust that, you've picked a practitioner and a clinic who's going to look after you, and, try as you can.
They've got you. That's the main thing.
Yeah.
Absolutely. I am so, so grateful for this amazing interview. I think we had some really great discussions around how great, especially with the AI inclusion and with all the research-backed facilities that the clinic is providing. And then we've got such an amazing staff like you and your team. So, how is it that they are going to get connected, and the best way is to seek a consultation first, and then they will take it from there?
Well, we have a wonderful Instagram account with lots of ways of contacting us. You can message us directly through there, our website as well. If you find me at IVF Support UAE, you can send me a direct message and I can connect you. There's lots of ways, and there are lots of pretty incredible doctors at Orchid, and there is really someone for everyone, I think.
Absolutely. I totally agree. And I think I want to thank you for this amazing morning where we had this great interview, and hope to see you again in the next episode. And thank you, Cassie, for being here.
Thank you so much.
Thank you. And thank you, everyone. And see you next time.